Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
This is going to be a very interesting show. I love to say that my shows are interesting, and you know what? I think they're great and they're a lot of fun. This is going to be interesting, but it's also going to be a little creepy. It's going to be it's going to be very knowledgeable. It's going to be very informative. But, you know, you might want to take a pen and some paper and quickly jot down a lot of information that you are about to learn. Did you or any one of your children or a relative or a friend ever come down with lice? That's right. I'm not kidding. Lice. Did you ever find out about one of your children having it in their head? They're scratching and they've got lice, and you don't know what to do about it. You call your physician, and the physician says, "Well, just take this shampoo, and that's the end of it." And shampoo, the physician doesn't really treat you for it. You don't go there and do anything. The physician's got other things to do than treat you for lice or take care of your kids. I somehow became acquainted with these two people who you're about to meet, who took care of a family member who had lice, and I was just absolutely surprised with what I saw on how they got rid of it and what they did. No, they didn't put garlic and beads around the neck and do some dances and chants. They did some very interesting things that really shocked me. So I asked them if they would come down here and discuss it, because it's just fascinating, because it is an epidemic, and you're going to learn more about it. And I got a chance to film them actually doing this process on a young girl. So you'll see how it's being done, and you'll learn a lot. So without further ado, let me bring to you two very interesting ladies. Wendy Beck. Hi, Wendy.
Nice to be
How
here,
are you?
Wendy.
It's great to have you here.
Thanks.
A lot of fun. Do I see something crawling around in your head?
Oh,
Only
I hope
kidding.
not.
Only
I'll
kidding.
have to let Penny check.
Penny good.
Nice.
Okay.
Nice to see you, Harvey.
Great to see you as well. Okay, so did you like that introduction?
Yes,
Yes,
Is that
it was
interesting?
excellent.
very nice.
Okay.
It was very impressive.
Is the infestation of lice an epidemic, or it really is not a big deal? It doesn't really, not too many people have it.
It is an epidemic of tremendous proportions. It affects everybody, kids, adults, even little babies get it.
Mm-hmm.
And we've seen several hundred families battling this problem without any answers. And we have found out how to get rid of it.
Mm-hmm. Well, we're going to get to that.
All righty.
We're going to discuss it, we're going to show it, and we're going to go through the whole thing, because I'll tell you, I thought it was a joke. When my physician told me to contact you, I said, "Are you kidding me? It's a joke." Now, you got this company that you call Lice Beaters. I thought he was saying wife beaters. I said, "What are you talking about?" Lice Beaters. I'll tell you, this is amazing. So let's get down to it now. First, what is lice? Or one is called a louse?
One is called a louse.
Okay, you louse. Okay, so lice, louse. Okay,
We
what
have
is it?
pet names for those.
Okay, what is
Lice
this?
is a parasite. It was actually one of the plagues.
One of the plagues. That's
One
right.
of the plagues.
Right.
And it's been around thousands of years.
Mm-hmm.
And once you get lice, they do not go away on their own. So they do require a lot of treatment.
Mm-hmm.
And that's what we do.
Right.
But it is a parasite. It sucks blood from the scalp.
Yeah, let's hear about this.
Yeah,
so
it
jumps
bites
on
you.
It bites you. It
No
sucks.
jumping.
Right. Okay, wait. Let me understand this. You usually hear about it in kids for the most part.
Right.
Why? Why is it with kids more so than with adults? Of course, adults get it, but why kids?
Well, the kids are in close proximity to each other, and it's head-to-head contact. The kids have sleepovers. They wrestle together. They play soccer. They don't have any concept of personal space. So when their hair touches another child's hair,
Right.
the bug crawls out of one child's hair to another.
So it
And
crawls,
that's how
it
you
doesn't
get
jump.
It doesn't jump,
No
hop, or
jumping.
fly. No.
It just walks, and the head
It
is so
walks.
close, it goes from one hair to another hair. That's, I'm assuming.
That's exactly
hair is a
correct.
bridge?
That's exactly it, yes.
Yep, that's it.
Okay,
Yeah.
so now this thing is crawling. I'm sure my viewer right now is going like this. You know,
Right.
everybody's scratching like crazy right now. Okay,
Right.
so this little louse goes from one kid's head to another kid's head, jumps on there, and does
Nope,
it?
no jumping.
I'm sorry. Walks on there, you know, and walks and goes right onto the scalp. And then what does it do? It goes to the follicle or something?
It bites the scalp. Okay?
Anywhere on the scalp.
Anywhere, because it
Anywhere.
needs blood to survive.
No
Okay.
blood dies.
Right.
Right.
And then
Right.
it lays the egg on the hair, not on the scalp, on the hair. And the
Not
egg,
the follicle, just on the hair. the
Right on
strand.
the
About a
hair.
quarter-inch down from the hairline.
right,
Okay.
and it will stay on the hair. And as the hair grows, it goes along with the hair. So you can see eggs, otherwise known as nits, anywhere on the hair. And some people have it for months and months, and they just can't get rid of it.
Oh my God! Because I know that the doctor says, well, just take these pills or take this shampoo. Or something. That doesn't do the trick.
No.
It doesn't do the trick.
No, it
Okay.
does not.
This is just fascinating. Before we show the video clip on how you get rid of this, let's discuss some more of this stuff. Can you? I mean, these might be old wives' tales, you know, debunked,
Yes.
demystified. I mean, if Mary Jane has lice and she lays down on a pillow and she gets up, and then 2 hours later, you know, Jim Smith puts his head on the pillow, is he going to get lice?
It's possible, but unlikely.
Why is it
Unlikely.
unlikely?
Because they don't ever want to be out of your hair. Your hair is like the Waldorf Astoria for lice. So they are designed to stay in your hair. That's their environment. That's the only place they can live. So getting onto a pillow is not something they're,
They don't
moving
want to
toward.
do it.
Right. They don't want to do that. They need to be near their food source.
Right.
And that happens to be
Blood.
your lovely scalp.
I see. Okay. Do they go to other parts of your body? Say you're a real
No.
hairy guy.
That's a totally different bug.
Really?
Head
Yes.
lice only want your head.
Head, hence the name head lice.
Exactly.
Yes.
Wow.
Yes. they don't
Wow.
want your head.
Wow. Very interesting. Okay. How long have you been doing this stuff?
We've been doing this together for 12 years.
12 years. You've been.
Yeah.
12 years.
Lice is my life.
And
Lice.
we're very busy.
I'm sure you
'Cause
are.
lice, it's everywhere.
I'm sure you are. 1 second. Got it. Okay. So that's. You said it's everywhere. Okay. How did you learn to do this? I mean, how did you learn to?
Well, both of
to
us
beat
have
lice?
both of us have children, and
Right.
our daughters had lice years ago.
Right.
But at that time, the shampoos worked. Now the bugs are resistant to
Oh, is
all
that
of the
what happened?
pesticides.
Yes. Because 25 years ago, the shampoos, over-the-counter shampoo treatments, had DDT in it.
Get out of here. Really?
And it was the DDT that killed off the bugs.
Killed you off too.
It killed off basically everything. But that became illegal. So all that was left was the plant-based pesticide, which the bugs quickly adapted to. So they're no longer susceptible to that pesticide.
Right.
So 90% of the bugs that are around now are wise to the pesticide, and it has absolutely no effect on them whatsoever.
Interesting. Okay, let's show my viewer. Okay. I know that you're really going a little crazy right now. You're scratching, you're itching, you're saying, all right. So how do I get rid of this? How do I? You're not going to believe how holistic, how natural, and how uncomplicated it is. You can do it. You can do it. It's easy to do. They're experts at this. You know, just amazing. They're just amazing. So why don't we do this? I want to get the high sign from my crew when we're ready to, run the DVD. We're ready to go. Okay, so I want you ladies to talk over it. We're going to watch the DVD and we're going to tell us what we're doing. I was looking for glasses
okay.
here. Okay, let's run the DVD and we'll see the process of how you get the process of how you
The
get rid. Now,
process.
what are we doing? Go ahead, Wendy. What are we doing?
Now, we first got to the patient's home, and first we're going to look in her hair when the hair's dry to identify how bad a case she has.
What's that
already.
white dot that I see right on the hair strand in the
That's
center?
the knit.
That's
That
the
is
egg.
the knit,
Knit,
otherwise
egg.
known as
Right.
the egg.
Look in the
That's
center.
right.
You see that? That's the eggs.
Right.
Oh,
You
my
did
God.
a good job zooming in on that.
Over easy. Okay.
Perfect.
All right. So now you're looking. You're look. There's another one.
There it is,
Yep.
hanging.
That's a very good picture of it. It hangs on the hair at an angle. It's glued on.
Doesn't move.
It doesn't move. It doesn't fall off. And if
Okay.
you,
Now, what are you pouring on the person's head?
this is olive oil.
Olive oil.
Yes.
Okay. Nothing.
Just
yeah,
olive
just
oil.
olive oil.
Olive oil suffocates the live bugs.
Say that again.
Olive oil suffocates.
The live
Suffocates
bugs.
the live bugs.
Okay. Good. So you saturate the hair.
Right? You put a lot of olive oil on,
Now-
and now we're combing it. We're getting all the knots out. That's
Right.
the first
Knots
thing
and
we
nits.
do. A lot of people have very knotty
Well,
hair.
that comb
Oh, yeah,
will
the
not
knots-
take out the knits. That comb
Oh,
will
so you are just getting
only-
the hair knots out.
It'll only
What
distribute
kind of a
the
comb is
oil.
that?
That's a knit comb.
Okay.
Okay. Now with the olive oil in the hair, we go through the hair with the knit comb, and we take out all the knits. Okay.
You're
So we're
wiping
gonna.
it on paper towel. Looking.
Yup. We go through the hair. We do this for about 10, could be as long as 30 minutes, depending upon how infested the patient is.
Very tedious
So we do
work.
this, we swipe it, and we wipe it on a damp paper
Oh,
towel.
look at that little thing up over the nail.
That's right. That's the little bug that's developing inside the knit.
Sounds so cute. Little bug.
And here we are. We have special lamps so we could see everything. And now we're going to wash out the olive oil, which is a little tricky at times to do.
Okay.
So we found out that when we combine shampoo
Right.
and like a dishwashing liquid,
Oh,
And-
detergent.
detergent,
Yes,
right?
Detergent.
We put it on first, work it in, like we're doing now, and gradually add water. And then we're just giving her the best hair wash she's ever had.
Good. Now she's getting it rinsed off.
Yes, now
Right.
she's getting rinsed.
I mean, she's got long hair.
Yes, she did.
She did. And we're rinsing it off.
Okay. Do you shampoo it again?
No.
Just
no,
that one
just
time.
Only
once.
once,
And
Harvey.
but then we do condition it.
Okay. For obvious reasons, I mean, of course, your condition hair, but is there a therapeutic reason for conditioning it?
Not really.
Okay.
The olive oil is a great conditioner, but when you apply the harsh detergent, it strips most of it away.
Okay.
Some of it has seeped in, so it does leave the hair ultimately
Okay.
beautiful.
So now you've washed it, you've conditioned it. you
This
got
is
rid of
her-
it. Now what are you doing?
This is her mother we're checking, okay? Because often the parents get the lice from the kids, and that's when they get really, really upset. So we're just checking the mother, and we're
Yes.
going to take all the nits out of the mother's hair. And that's what we're doing here. It's the same way. That's the little developing bug.
There's the child.
Okay, now we're back
Yeah.
to the child. Okay, and now we're checking her hair when it's dry.
Yes.
So we're looking
And she's
through
all
it, and
finished.
she's all ready, and she's happy.
Now,
And-
at the end of, excuse me,
Go ahead.
at the
Pretty
end of
girl.
the treatment,
Yeah.
we reapply the oil because that little span of time when we were using the oil to comb is just for combing. That's just to make the combing efficient. It is not the nightly treatment.
Okay, we didn't
They-
get to that yet.
Yeah.
Okay.
Okay, wait. Hold the phone. Hold the phone. So all you did right now is the first part.
Yes,
Exactly.
part one.
Okay, I don't want my view. I don't want you thinking that that's it. You wash the hair with olive oil and goodbye, good luck, and then maybe you put a little pasta in the head too. No, doesn't work that way. Now comes the hard part. Now comes the pain in the neck stuff.
Right.
Okay, what do you now do, and what do you tell the parent or whoever else to do it? What do they got to do?
Okay, well, now it's up to the parent because they have to begin our 3-week olive oil treatment plan, which is basically saturating the hair with oil
3 weeks.
every night for 1 week and every other night for 2 weeks. And you're going to saturate the child's hair with oil right before bed. Okay, and then you're going to put it on top of the head if it's a girl in a pony with a shower cap over it. We don't recommend the shower cap for young children, but they're going to sleep with the shower cap on because we want the hair to stay wet. Because remember, olive oil is going to suffocate the bug.
Right.
Okay? And they have to do that. And in the morning, you just wash it out just the way it showed on the videotape.
Okay, but now at one application is not going to do the job.
No. I'll let Penny explain this.
Right.
Getting rid of lice is a process. So you start with live bugs, they lay the eggs. We come along, we take out every egg and every live bug we can see. However, what's left behind, inevitably, are nits, little eggs that are too tiny to be seen on the day of treatment. So the whole purpose of the olive oil treatment plan is to cover the patient for the eventuality that one of those little tiny nits is going to survive and hatch.
Right.
So by doing the olive oil, all of the onus is off the parent. If they never looked in the child's hair again, the case will end. But if they want to look through and take nits out, that's great. But if you never took any out, the case would end.
Just because the olive oil is suffocating.
Yes, exactly.
and that's it. Now, is it that the egg needs the air, or does the olive oil encase the egg so that when the nits, when the eggs hatch, the babies that pop out, they're just stuck in this goo, and they can't function?
Basically, it's very simple.
Go
The
ahead.
olive oil just suffocates the live bug. It doesn't do anything to the nits. So if there's a nit in the hair that we're not going to see because they take a week to 10 days to mature,
Right.
and then it hatches, okay, the olive oil will suffocate that little tiny bug
As it grows.
before it's old enough to lay eggs.
I see.
And by doing it for 3 weeks, you're completing the whole life cycle, and everything will be dead by the end.
Okay, so people have to understand this is a 3-week process.
Right.
And you initiate it.
Yes.
You do the
Exactly.
first step, and as you do it, you're showing the family member how to do it.
Exactly.
As you do it,
Yes.
you say, watch me, because you're going to be doing this.
And we give them the printed directions.
Right.
So they always
right,
have a
right,
reference.
Right. Now, does it matter what olive oil? Is it,
No.
you know, I mean,
we always
light
say-
olive oil, get the cheapest olive oil you can.
The cheapest because you're going to be using a
Using a
lot of
lot,
it. And olive
yeah.
oil is expensive.
Right. It is expensive. That's
Yeah.
what I was
Really
saying
is.
this here. So just get the cheapest thing that you can.
The cheapest
Exactly.
thing you can, but we don't want the patients to use blends, olive oil blends, which would be an olive oil with a soybean oil or a canola oil.
Right,
or
just pure olive oil.
pure olive oil. It can be light, but it needs to be pure olive
Pure
oil.
olive oil can't be, and no other oil? I mean, why can't you use a vegetable oil?
Well, they would work. They would work. And you could use motor oil. It would work.
Yeah, but who wants to
because-
stick motor oil in the
Right,
kid's head?
Exactly.
It's going to suffocate the bug.
And the kid.
Maybe. But the olive oil is known to be good, and it's known to be somewhat hypoallergenic.
Yeah.
And since we don't have the medical histories of all these children, we think it's wise to only recommend
right.
something
Right.
that's not likely to cause a new problem.
So it's interesting. So the baby louse hatches in 7 to 10 days. So that's why it's good for the 3 weeks, because you're covering all these hatching that could possibly be
Right.
going on.
Well, the thing is, when it hatches, it's not old enough to lay eggs. It needs another 10 days to grow until it could lay eggs. So you're killing that bug as soon as
At
it's
its
hatched.
infancy, right?
Exactly.
When it's more susceptible. It didn't build up
Right.
any
Right.
strength or anything
That's
like
correct.
that at
Yeah,
all.
it's like a little teeny feather, piece of a feather.
Oh, now what can people do to prevent this from happening? What do you tell your kids?
Okay, well,
you look at
we
you want to take it? You
have-
want to take it? You want to take it?
Well, if you have young boys, we suggest a buzz cut because if they don't have any hair, they're not going to have any lice. And for the girls, we always tell the parents, tie your child's hair back in a braid or a bun, okay? It cannot be loose.
Yeah, it cannot be loose.
Oh, you're right. Where's one strand?
Yeah,
and,
they're all
and
ladders.
the sucker walks.
Right.
Yeah.
They're all
We also
ladders.
tell them to put hairspray and gel in their hair because lice like clean hair. That's the myth. A lot of people think lice only go to dirty hair, but in fact, they like clean hair.
Right.
And that's who gets
Right.
it. So nobody's immune to it.
Yeah, no one.
It
that's
affects
right.
everybody.
Right. Now, why is it, well, I guess I know the answer. That you am I correct in stating that you see this more so in the summer than in the winter, or not really?
Nope, it's always
It's
around.
always around.
Always
Yeah,
around.
it's always
Somebody
around.
always has it. It's like the cold virus. Somebody always has lice.
Just amazing. So you don't really have a season.
No.
It's just it's just consistent.
Yeah,
time.
it is. It is.
See, I was very impressed that I found out about you from my pediatrician. That was just fascinating. I mean, I thought it was a joke when he, said to me,
Right.
these people come over to your house and I pictured you going to be voodoo and you could jump up and down with bones through your nose and everything else, and then all of a sudden I see what you're doing. And I saw how serious you were. I said, wow, this is very interesting, and it worked.
It works.
And it worked,
Yes.
which was amazing. What kind of advice could you give people as far as lice is concerned? Is there any? I mean, your experience is so
Well, we're
long.
basically telling parents to keep your child's hair back. And when if they're going to have a sleepover, not to sleep right next to another child and to, keep your hair away from everybody else's. That's all you can do. But kids are kids, and you can't watch everything they do every minute.
Right.
So, I mean, you know what? If they get lice, they get it. I mean, although the parents think it's a big deal, it really isn't. And it's easily
remedied.
remedied.
Now, what about everybody saying, well, you better take your clothing and you better take your bed sheets and you better take this and you better wash it in hot water and all this kind of stuff?
Yeah.
No, it's irrelevant. Because
they're not living. There's no blood.
Exactly. There's no blood. They are parasites specific to the human head. So without the human head, they're goners.
Wait a minute. They don't attack animals?
No.
Like dogs? I mean, that's a
No.
flea.
Nope, your
But-
dogs cannot get lice because they don't have
Dogs
human
and
blood.
cats cannot get lice.
They only live off of human blood.
Yes.
I didn't quite, I heard what you had said, but I didn't grasp that it was human blood.
Yes.
I mean, all of a sudden they're particular.
Yes.
So then where does this come from? It comes from the dirt? I don't understand. How do you, I mean, where does it initially come from?
Someone
Chicken or
always
the
has
egg?
it. Someone always has it, like chicken pox or the cold virus. Someone always has it. So you just need to get it from that person, then you're going to spread it around to 10 people.
Oh my God. Oh my God.
Before you know you have it.
This is amazing. You better not conk out on me because I know you have allergies and you took some Benadryl, and I know because you don't want to be sneezing and honking and choking and everything else
now
before.
I'm just going to be asleep.
I know. I just want people to understand that. It's a whole other doctor.
Yeah.
I
Yeah.
just want to mention something
Yes.
that what a lot of parents do is keep it a secret. They don't want anybody else
It's
to
true.
know.
It's true.
And-
They think there's some kind of a stigma.
They do,
Yeah,
and there
they
really
do.
isn't. So we're here to tell everybody, don't worry about it. It's not a big deal. It doesn't mean you're dirty. Just take care of it and alert everybody else because you don't want your child to get it back from somebody else.
And everybody, I mean, really, this is the most active year, busy year we've had.
Really?
Everyone has
What's going
it.
on? I mean, why? I mean,
Well, people, the pesticides
Pesticides
are
don't
getting
work.
weaker. And by the time somebody calls us, they've already used the pesticides 3 or 4
they've
times.
been through it all.
Right.
They've been
You're
through
the
it
last
all.
resort.
They have
Exactly.
terrible cases. They can't get rid of it. The house is totally chaotic. Everybody's crying. And basically, you just need olive oil.
Well,
And,
people
You have to
don't
know how
this.
to do it,
They
right?
Right.
don't know it. I hope they learn it from your show.
Well, this is. I'm impressed, and it's nothing so magical.
It's not magic.
It's not magic. Now I noticed when I watched you ladies on the video, there were no gloves. How come you didn't wear gloves, or it doesn't
Well,
matter?
we don't
or
wear
what?
gloves because we can't grab the knit with gloves on, and we just end up pulling the child's hair.
Yeah, it's painful.
And it would be very hot also for us. So we're not afraid of it. There's nothing to be afraid of. We always wear our hair back. And remember, they would have to crawl, so we would see that bug heading towards us.
Right.
That's so funny.
So we're on
You
the
see
lookout.
that's so funny. So did you ever get lice?
We
Come
got
on.
it one time.
You
We
did?
did. We got it one
We got
time
it once.
from the very worst case we have ever seen.
Really?
Yeah, the poor child had it 5 years.
5 years, and she was homeschooled because the
They
school
couldn't get
wouldn't
her
allow
into
her in
school.
because her case was so bad.
So why didn't the school do something to get rid? Why didn't they tell her where to go?
I know.
They didn't know. I
they
guess
didn't know.
they just didn't know.
That's amazing.
She
Yep.
used every over-the-counter product, everything, and nothing worked. And the kid had millions of little critters when we saw her.
Nits
Oh,
and
my
bugs, and we
And
could take
did
one
you eradicate
swipe.
it?
Yes, we did.
Got rid of it.
And they were very, very grateful.
Yeah, we haven't
So,
heard from
so
her.
and so, so then you got it. Both of you got it.
We
Yeah.
both got it. Not bad,
I
you
said,
know.
How did you know you had it? What's the symptoms? What-
somebody I was a little itchy, and then I kind of felt something back here, and I had my associate look at it, and she said, "You have an egg." And then I called Penny, and I said, "Penny, I'm itchy." She goes, "So am I." I said, "You can't have it," and she had it also. So we
had
both
it.
got it.
So you
and
did
we
each
did
other.
the olive
Yeah,
oil.
we did the olive
And it
oil.
worked.
You know,
it works.
it's a very spiffy look, you know,
Yeah.
especially with the shower cap, and
Right,
we
right.
did what we had to do. We followed our own directions,
Oh my God. Oh.
and it worked.
It's foolproof.
And we do not have
really.
any lice now.
No.
Yeah. Oh
But
my
everybody
God.
always asks us that.
I just thought this would be. I just thought this would have a lot of value to my viewer watching this,
Yeah.
because people come across this, they don't know what to do. You know, if you want to get more information on this, there's a phone number at the end of the show where you'll be able to give me a call, and you know, we can, like I always tell my viewers, if you want to get more information on any one of the guests who are on the show, you certainly can, at the end of the show, you'll catch the number. And we can give you information on what you can do, and if you ever need to contact these ladies. So it's there for you. We got about 2 minutes left. So it's not a matter about being clean.
No.
It's a matter, you could be the cleanest person in the world, but the
Yeah.
only way you're not going to get it is if you're Yul Brynner or somebody, he's dead. But if you get someone
Right.
who's bald,
Yeah.
Yeah, bald.
or stick lots of gel in your head
Or
like
if
me.
you wear a lot of gel, that's a
Right.
big help. For boys, we recommend keep the hair as short as possible.
Right.
And for girls, you've got to put it back in braids
Definitely.
or bun, because that hair is the ladder. And even in a ponytail, that hair is still loose in the back.
Mm-hmm.
And that's just the right environment for a bug to crawl in and
Yep.
wreak havoc with the family
Yeah,
life.
just
So-
keep the hair back, and if you do have it, tell your friends and tell the school nurse, and you'll find out that 5 of your friends have it as well.
Oh yeah, absolutely.
So
Right.
it's not only you, it's everybody, and it's in every school, every sleepaway camp. A lot of kids get it at sleepaway camp.
Mm-hmm.
And
So you're not going to get it if you're out in the woods.
no, you
It's
don't
not
get
from
it
the woods.
I know,
no.
I know. I'm beating this like a dead
Yeah,
horse.
no,
Just
but
want to make
people
sure
are
you're not going to
curious
get it from
about
rolling
that.
around in the dirt.
You
Yeah,
only get
no.
it from another person
From another
who has
person,
it.
another person. Wow, unbelievable. Listen, we got to go. The time went by like that.
It did.
Is that amazing?
Yeah,
It
really
was.
fast.
You think we got the information? You think
Yep.
we
I
gave the right
do.
information? It was
Yeah.
all done?
I hope we can help people out there because
he's terrific. You have to have helped people. I'm sure there are thousands of people watching this going to say, "Oh my, let's do it. Get the olive
Yep.
oil." Terrific, Wendy Beck.
nice meeting you.
Terrific, Penny Good.
Thank you, Harvey.
Oh, it's just very informative, and I really appreciate you taking the time to
No
come down here. I
problem.
thought this was great.
You're very welcome.
Just terrific. You beat them lice.
We're beating
You
them.
beat them. Okay. So I hope you got a lot out of this. I know it's a little creepy crawly show, but I want to tell you something. It's good information, and you know that there is help out there. There's always help out there. Always. No matter what your problem is. And this is another one of those things. You don't have to be stuck in a corner going, you don't know what to do, and your kids can go to school. This is great. Good stuff. Okay, so I hope you enjoyed. Look for the phone number at the end of the show. And until next time, like these ladies with their lice, whatever you do it with passion. Otherwise, what's the use? Okay, take care. Dr. Pass saying goodbye. Put it there.
Bye-bye.